So, well, it was not like one day that I got up and decided to do my first surgery. The training was in a great process, which seemed more of a peregrination to me as a beginner. From the first day of my wet lab training, I took it like fish to water. I spent long hours, much beyond the working hours, trying to learn the technicalities of the microscope, the ergonomics of the instrument which I was dealing with, and to learn initial steps of stereoscopic vision, hand-eye coordination, or ambidexterity, without which I would never qualify to become an eye surgeon. I remember as first year residents, we used to visit the butcher's shop to procure the goat's eye to practice every morning, even before the hospital started. I spent equally long hours trying to master an incision or suturing on a potato or a tomato or a sponge for that matter with those impossible hair-thin 10-0 monofilament nylon sutures under the microscope. Now this took hours and hours of training only to realize that the physical skills could only be achieved through repetition. So what I eventually found out was that practicing on animals' eye and operating on humans' eye are essentially two different things, and that there was no starting over from the beginning in a real human being. So after months of intensive wet lab training, I was given the green signal to proceed my footstep towards the OT. I prepared myself by learning the simple rules and ethics that govern the complex working environment. As a beginner, I was not allotted a case instantly, but first I was expected to start by observing the surgeries, then practice to be an expert in assisting that surgery, when sometimes my consultant would feel benevolent to teach me and ask me to perform some easy steps of the surgery like creating a side port or a peritomy. Then finally, the day came when my first teaching case was allotted under direct supervision. I was nervous, little scared, but assured that I had great help. My first post-op was definitely a perfect one, with the patient having gained almost perfect vision, but I wouldn't have that undescribable feeling of being a surgeon as my consultant had to step in during the complicated parts of the surgery. So going retrospectively, I realized that I wouldn't do my first full cataract surgery till 3 to 4 months later. So putting in brief, the journey for a beginner from wet lab to OR till the first case is a long and meandering one. My first case, once I was qualified as a surgeon, I remember I was nervous and little scared and assured once again. The assurance came from the knowledge and experience that I had gained through years of training. So wet lab plays a major role in enhancing the confidence and surgical skills of the resident, which is ultimately manifested in the reduced rate of complications. Now, wet lab is an integral part of any teaching institute. Its importance in ophthalmic residency has been recognized and mandated by Accreditation Council of Graduate Medical Education in 2005. The importance of it is being more increasingly emphasized during this global pandemic, as the number of free surgeries and the recent shutdown of camp has led to the reduced number of surgical training of the residents. Dr. Henderson has cited in this article that resident wet labs are one way to offer thorough balanced training. Now, my journey from wet lab to OR got reversed when I joined as a consultant in Sri Shankar-Deva Netralaya, Guwahati. There again, I traveled through the same journey with the DNB residents, though in a reverse route. Having been traveled earlier, it was not an uphill task for me to guide the residents. I always persuaded them that how much peregrinated they would feel. It is always rewarding in the end. Discipline and consistency are the two main factors required during the wet lab training. Practice makes one so good that surgery can happen almost unconsciously without the mind acknowledging each step. And last but not the least, always to focus on quality, as the number of surgeries is never a true indicator of surgeon skill. Thank you so much for kind attention and having me on board.
Thank you, Dr.